You need to narrow down a pitch for your client. This is how I am going to cater to you. How do you get a potential client who is on the fence about your services to book with you? All right, let's get into it. For those of you who do not know me, my name is Christine Bonaventure. I am a registered nurse. I am the owner of At Home Concierge Nurse here in the Raleigh, North Carolina area. And my passion is, I'm not a YouTube creator, but my passion is hopping on YouTube and sharing what I've learned in this past year of being in business with you. So hopefully you will get out of your head, jump out of the fear, and start your own business. If you're ready to start your own business, I do have a Concierge Nurse Academy at $9 a month where there's templates. You can ask questions. I go live on Tuesday nights. We can do that. If you're interested, click the link below. Okay, boom, let's get into it. I realize YouTube tells me I got to do all my commercials in the beginning because if I do it at the end, people don't watch to the end, so they don't hear. So bear with me. I'm a nurse creating content, but I got to apply some of this YouTube stuff as well. Okay, boom, let's get into it. Okay, boom. So, true story. This is actually real life, right? I had a client today is Tuesday. I had a client contact me last week, Wednesday or so, asking me if I was available next Tuesday, in a week from now. Okay. And I told her, yes, I was available. I asked her what type of surgery she was having. She told me, and she was referred to me from one of my surgery centers, like the majority of my clients are. Like I said, this population, I rarely have to go searching for them because they come straight to me, right? So I was like, okay, we chit-chatted for a little bit, and she was like, well, I'm going to get back with you when she gets more information from the surgery center. I was like, perfect, let me know. So yesterday, Monday, I sent her a text, and I was just like, hey, just a reminder, I'm just asking if you still need services for next week, Tuesday. And she's like, yep, yes, she does. She just needs to finalize some things with the surgery center, and then boom. Okay, boom. So today she sends me a text and she's just like, okay, yeah, I'm still available. No, she said she's still she's still having a surgery on the 30th. And we were talking about the price, right? So my 24-hour price is $2,400. Okay, that for me that's transportation. I'm going to take you to the surgery center. Okay, I am going to pick you up from the surgery center, and I will be with you for 24 hours. Right? When I drop my clients off at the surgery center in the morning, I go back to where we are going to be staying, and I prep the area. Okay. And depending on the surgery that we're going to be having, I have chuck pads, I have aromatherapy stuff, and I just set it up. I get some flowers, I just set it up to give it like a little bit of a luxury, if you will, vibe. Okay, so the client, we're chatting today, and I could tell that she's just like, $2,400. Okay. Because a couple of months ago, I had a client who, she was like, I had a potential client, and she was like, well, I'm not going to go with you. And I was just bold enough to ask why, because I was getting a lot of no's at that point. And I was just like, okay, like, can you let me know why? And then she told me, she was like, there is a lady who is a CNA in the area. She's been a CNA for 25 years, and she charges $30 an hour as opposed to my $100 an hour. So I was like, okay, understood, right? So that's when I began to realize, okay, I'm not going to bring down my price, right? But at the same time, I need to change up my marketing. I need to change up what I'm saying, okay? And this is what I've come up with, and this has really, really helped. As nurses, we want to give our resume. You need to hire me because I used to be an ER nurse. I used to work ICU. I'm this, I have a cardio, I have all, right? I was giving my resume to these clients. They don't care. They don't, yeah, that's wonderful and all, but they don't care, right? And then it hit me. They want to know how I am going to make them feel special. How are you going to cater to them, right? This is a luxury experience, okay? So today I was telling her, well, I only have one client. You will be my sole focus for 24 hours. When I drop you off, I'm going to come back and I'm going to fluff up the area. I'm going to go ahead and get your food ready for you, that type of stuff. We're going to have aromatherapy sessions. We're going to have this. I'm going to make sure your meds are ready. I am going to give you peace of mind. I am going to give you comfort. You are going to be catered to in every way possible. All right. And we hung up the phone, and then about maybe 40 minutes later, she sent me a text asking me to send her the contract. Okay. So when you have a client that you can tell they're kind of like, drop the resume, right? And now we're not patient-centered anymore. These are our clients. Clients expect top-notch service. What top-notch service are you going to be providing? That is something we have to start getting into our heads also. Not only having our pitches for the to the providers and the social workers. Oh, well, this is what I do. You need to narrow down a pitch for your client. This is how I am going to cater to you.